Welcome to another edition of the Business and Personal Podcast, where we bring you closer to those that you do business with. And we're real excited today to have Dr. Jeffrey Kutcher on with us. He's an internationally recognized concussion expert. He's worked with several professional sports leagues, the Olympics, and at the collegiate level as well. So very well versed in the topic of concussions, and with the Super Bowl coming up, and a lot of question recently on whether or not Patrick Mahomes had a concussion or not. I thought it'd be a good time for him to come on and talk more about that. So, Dr. Kutcher, first of all, thanks so much for joining us today.
Oh, you're welcome, Ryan. Thank you. Always a pleasure to talk about these issues.
So, obviously, you have a deep background in this. What exactly makes you so dedicated to brain health and learning more about concussions?
Well, I think it starts with my own experiences. I grew up here in the Detroit area playing hockey, as an athlete early in my life. And when I became a neurologist, I realized there was a huge gap in the neurological care that athletes were being given. And sort of going back to even before concussion was an issue, I started working with athletes and dedicating my professional career to providing the best possible neurological care. And that is more than just concussion. I mean, concussion is the term everybody knows now, but there are a lot of neurological problems, processes, injuries, things going on in the athletic population that all deserve our attention. And so, when I first got into this, I realized the impact I could have, not only locally here in Southeast Michigan, but nationally and internationally, to help change the conversation, ultimately to improve neurological health. And to me, that means more than just being aware of the negative things that can happen if you are injured, but also being very aware of the positive things that happen from playing sports. Far beyond just, getting exercise, and that's super important, obviously, to control cardiovascular risk factors and general health. But the huge benefits that playing sports provide a developing brain, for example, is just completely underappreciated. So for me, as a sports neurologist, I'm very clear, whether it's here in my clinic seeing patients or doing research or educating or doing advocacy or policy work, that it is about athlete brain health. And whether it's just starting out playing sports at age 6, or you're 96 and you played in the NFL, or whatever it may be, anywhere in between, there is a role for people to engage in neurological care that is comprehensive and meaningful.
And how much of a help was it for you working with those high-level athletes in the professional level, Olympic level? What sort of things were you able to learn from those experiences?
Well, so much. To start, I'll say it quite honestly, I learned something from all of my patients. Every patient interaction is a chance to learn. And I've never stopped believing that, and I keep that in my practice every single day. As far as the different levels of sports, each of them have a different series of challenges and, sort of things you learn from. At the elite levels, you learn about the upper ends of human performance, right? And what it takes to perform at that level. And then how you can apply not only the principles and the types of things that those types of athletes go through, you apply that to other aspects of life. So in my world, in my program, for example, we have a very broad definition of athlete. It's not just somebody who's playing a team sport or a well-known individual sport. It's anybody who has a performance quality to their life. So performance arts, even you can imagine business leaders, anybody who has that kind of performance need in their life is an athlete to us. So those elite levels, taking care of professionals, Olympians, just as a incredible kind of window into that psychology, and understanding not only what it takes to succeed, but what happens when you're injured, what happens when you're sick, what does the recovery look like, what are the expectations, how do you go from not just injured to sort of getting by, but injured to excelling at whatever it is you want to do. That's an incredibly unique thing, and having the opportunity to take care of athletes at the level is I'm super fortunate to be able to do that.
All the great efforts of you and others have brought so much awareness to concussions, and that's a good and a bad thing sometimes, because when all this information's out there, sometimes there's misinformation as well. Also, when we talked earlier about the Patrick Mahomes situation. Everybody thought he had a concussion. He looked all woozy, got up and could barely stand up anymore. Why don't you touch on maybe some of the misconceptions about concussions and Patrick Mahomes' situation more exactly, and how that actually was not a concussion that he had?
Well, frankly, we could do a whole podcast series on the misinformation about concussion, but I'll break it down as simply as I can. The term concussion is actually used across most sports and medicine and in general public very, very widely and haphazardly, and to mean many, many different things, when concussion actually has a very specific medical definition with a very specific pathology that goes along with it. It is a brain injury, a type of brain injury brought on by force that creates inappropriate electrical activity of the brain or slow activity of the brain. But by definition, concussion is a transient state. It goes away. There are things that can happen later in life as a result of being hit or being hit many, many times over and over again, but that's not concussion. That's a different conversation altogether. And the reason that it's important to know the difference is because concussions are incredibly common, right? I mean, estimates anywhere from 3 to 6 million or so concussions in the United States alone every year from sports and recreational activities. But the problems we all are worried about, long-term brain health, injuries beyond concussion, structural changes to the brain, those are pretty rare overall. But if you're the mom or dad of a 12-year-old hockey player here in Michigan who's had a concussion or 2 or 3, all you think of is either the movie that Will Smith was in or all the bad stories you hear, and you equate that with concussion, and that's just not true. So what I would stress is that people, if you encounter concussion or potential concussion diagnosis, come see us. We can delineate the difference between injury or not, concussion plus other things going on. And at the end of the day, if you look at how sports has pivoted, I think substantially to deal with the issue of concussion, and I think obviously we're a lot better off, we're a lot safer overall than when you and I played sports growing up. That pivoting, like you said, has come with a lot of good, but also some bad. And one of the bad things is it's assumed nowadays that if somebody takes some kind of physical hit or blow doing sports or any activity and has any of the symptoms on this concussion symptom checklist that is so popular, that you're concussed. And that's just not true. There are a lot of things that can cause neurological dysfunction, symptoms, and other presentations that look like concussion. So specifically about the situation you refer to, and I always try to stray away from talking about any one case because, Mr. Mahomes did not give us permission to talk about him. Whether I know he, obviously he's a professional athlete, so he understands people talk about what they see on TV, but I think they deserve every privacy right and every right that any patient has as far as discussing facts of cases. But given what we all saw happened, there are 2 decisions that happened, and I think both were incredibly appropriate, best I can tell, in a general situation. The first decision is a triage decision for safety, right? We have a player, any player, not just the one we're talking about, but any player has a hit, either a significant hit that is concerning, or any signs or symptoms that are concerning. You triage for safety. You remove them from participation for their own safety, right? That is not a diagnostic decision. That is not concussion, yes or no. That is concussion suspected enough to the degree that the right thing to do is to pull them out and be safe. But the problem is, and this happens too often in sports, people stop thinking at that point. And it's just, okay, I pulled you, so go into the concussion protocol because we've got protocols for this, and good luck getting out of it. But the reality is that second decision, the diagnostic decision, requires more time, repeat evaluations, after the game, 3 hours later, when you get back home or whatever, and the next day, and putting information together, doing testing. that diagnostic decision clarifies itself typically over a day or two, almost always within a day or so, you know pretty much what's going on. And so it's more common than people realize that if you see a hit on television or watching your son or your daughter's soccer game, for example, and you see somebody take a knee or somebody can't get up wobbly or whatever, like it's more common than people realize that that's not concussion. There are a lot of other things that can go on. But that doesn't mean that you let that person keep playing. It means you remove them, like I said, triage for safety, get them to the people that can make the right diagnosis. I think that kind of is what happened in this situation.
Yeah, definitely better to be safe than sorry. But let's talk about a situation, just any general situation where someone did get diagnosed with a concussion. Concussion took place. What is your best advice for someone, first thing they should do in that scenario?
Well, the first thing we always want to make sure, so let's assume there is that brain injury of concussion, is, well, let's make sure there's nothing else worse, right? So the thing that we all kind of worry about is a bleeding event inside of the skull or skull fracture. And that depends a lot on the mechanism of the injury. So whenever somebody's concussed, I really stress that whatever information we can gather about the mechanism, I mean, as specifically as possible. If we've got video, great, you know? So in other words, if you have a helmeted sport like football, you know, a skull fracture from a football play is incredibly, incredibly rare. I can't even remember seeing it in my 20 years doing this. But skull fractures in non-helmeted sports, you know, much more common, you can imagine, right? Basketball player, head to court, soccer player, elbow to head, those kinds of things. So you have to pay attention to the mechanism to make sure we're ruling out more significant injury. My general rule, I'd say for parents or coaches, is that if there's been a concussive event, you know, you pulled somebody, your kid or whatever, for about 4 hours or so, I want them to be observed by a responsible adult, not continuously, but at least, you know, in the general area. And if, you know, after 4 hours, they're communicative, they're able to communicate with you and describe things and talk to you, and they're, you know, more or less normal. They may have headaches and those kinds of things. You can pretty carefully, or I would say pretty easily say that that person probably doesn't have a bleeding event or anything worse. But then the next thing we want to make sure is we understand, okay, you're concussed. What else could be going on? Maybe you've got a neck strain. Maybe actually the trauma to the head that caused the concussion actually caused a cranial nerve problem that's producing other symptoms. So again, comprehensive evaluation to make sure we get all the diagnoses on the table. The first 24 hours or so really are about just observation and comfort. So we try to stay away from medications in the first 24 hours, particularly for headaches. Tylenol is fine to use, but typically doesn't do much. I should say acetaminophen, the non-brand name. But at about that 24-hour mark, and during that first day or so, yeah, it's probably a reasonable idea to rest a little bit, you know, just take it easy. But there's no rule that says you can't go to school or you can't, you know, go for a walk with your dog or something. This idea that a concussed brain needs to be shut down immediately is not only a myth, it's actually getting people in trouble. And so the rule I like to use is I want my patients to do in the first 24 to 48 hours or so, just what's comfortable, right? I mean, I don't want them to work out. I don't want them to maybe sit for the ACT or something, but they could go online and do a Zoom class if they're not feeling too lousy, or they could walk to the store. Those things aren't going to make their injury worse. One of the bigger problems we see with concussion is patients told to rest as much as possible. Go in a dark room, no screens, no whether it's your phone or computer or television, none of that. You know, don't do anything. You know, just step back for a second and ask yourself, well, if I just did that to the average person off the street and said, okay, person, let alone a, you know, active physical athletic person, don't do anything, come back and see me in my clinic in a week or two and tell me how you feel. That process of resting will generate symptoms. Absolutely, you know, in everybody eventually. And some people it takes a couple of days or so. And those symptoms, if you look at what they are, look a heck of a lot like a concussion, right? Their sleep gets weird, their mood gets off, they get anxious. If they've got a migraine problem, they'll get more headaches. These things add up to some cognitive problems with memory and attention. And all of a sudden you look concussed, and it's only because you've been resting too much. So that's one of the bigger, I think, messages I'd like to give folks is there's a time for rest and there's a time for understanding that rest can be bad. And getting to somebody who can do a thorough evaluation and determine when is that inflection point that we do want you to start getting active, whether it's physically, socially, academically, or any other way. Like, that's the key to having the shortest possible recovery.
And then once someone has had a concussion, are they more at risk to have another one? Should they be monitored even closer than someone that's never had a concussion before?
Yeah, that's a fascinating question, and one that a lot of people would assume is yes. Of course, you're more likely to. The answer is no. Physiologically, there's no reason to think that. If you look at data that have been published, populations that have been studied, there have been trends of people who have been diagnosed with concussion being more likely to be diagnosed again compared to their peers. But when you dig into that, you dig into behaviors of the health system and the people taking care of these folks, it is definitely the case that once you're diagnosed with concussion, it is much more easy to be labeled as concussed the next time you have any symptoms. So people kind of get put in this category of you're the concussion person. So every time you come to me after practice with a headache, okay, you're concussed again, that definitely happens. But as far as the actual injury itself, there is no neurological or physiological mechanism we're aware of that would change your risk of getting injured again. So in that way, they don't add up, right? Like one is not any better or worse than 2 or 3 or 4. And it really depends on each individual and what's going on in the whole person.
And I think it just comes down to the baseline testing and all the great things that you can do with that. And people should focus on that for detection and prevention going forward. Talk about the baseline testing, what you can do with that.
Yeah. So baseline testing, again, is something that kind of came around in like the late 2000s. All of a sudden, people started doing it. And what I'd love your listeners, your podcast viewers here to think about is there was this inflection point in 2008, the fall of 8, the spring of 2009, where all of a sudden people started caring about concussion in sports. There was no medical discovery. There was no like, oh gosh, I guess concussion is a thing that we didn't know about. People have been writing about concussions medically really since humans have been going to war. The first writings are back from some of the Greek medicine texts. But the point is that baseline testing was sort of the answer, well, one of the answers to, okay, sports world, you need to start taking this seriously. And so it was a big step forward. The problem is, again, much like a lot of aspects of this area of medicine, people have tried to oversimplify it. Well, they have oversimplified it. And it's become something that, oh, just take this test. And even though the makers of the test will say up and down, oh no, this isn't a diagnostic test. This is just to help clinicians make a diagnosis. They are used over and over again, these simple baseline tests, as diagnostic tests. Do you have a concussion or not? Is your concussion over or not? They do not do that. I can't be clear enough about that. The standard baseline tests that have been going on in the United States for over a decade have been more misused than used correctly in my experience by far. So what baseline testing needs to be, and this is what we do with our program, it really has to come at it from 3 perspectives, or 3 things actually that you can get out of baseline testing. And first off, I don't like the term baseline testing because again, it's oversimplified. We call it brain health baseline testing. So I'm talking more about just overall brain health. So the 3 things are, I'm going to evaluate a patient. I'm going to do a history. I'm going to do an examination that's focused to get information that's clinically relevant to the diagnostic decision. What is your experience with headaches? What is your experience with attention, mood, sleep? Do we have an examination finding, eye movements, balance that is your normal, but could be misinterpreted as abnormal on a sideline or in a locker So we gather information, again, useful clinical information. It's not magic. It's just a matter of doing the right thing and being sort of experienced in neurological evaluations. But you get that information, helps you clarify diagnosis. That's only thing one. Thing two is, in that process, you ask about very common problems that interfere with all kinds of productivity. So I mentioned migraine, attention, sleep, mood. These things are incredibly common in the population in general, widely ignored for the most part, unless you have a problem going to a doctor. But in this sort of brain health baseline environment, you know, you have athletes in front of you and you're like, oh gosh, like, no, you've had migraines, nobody's treating them. You have ADHD, nobody's treating it. And all of a sudden you're like, okay, they're better students, right? I mean, you've identified problems they've had. The third thing is establishing a year-to-year relationship that helps you monitor overall brain health in a very broad sense. So again, you know, looking at issues outside of just concussion. Do you have headaches? Do you have mood problems? Do you have cognitive issues? Are they getting worse? Why are they getting worse? How many sports are you playing? What sports are you playing? What position do you play? How many hits do you take? All those things are conversations you have on an annual basis. And for me, that's our biggest role, is to really act as a shepherd of our patients' brain health through their athletic career and frankly, the rest of their life as well, so that we're always having a critical evaluation and conversation about, yes, you're playing a sport or you're in the military or doing some other kind of physical vocation that's providing a lot of benefit. What are the risks? What are the negatives? Let's have that conversation. Let's make sure that you're still doing it for the right reasons. Let's make sure that you're not, you know, creating a negative brain health story for later in life. All of those things should be rolled into what I would call brain health baseline annual evaluations for athletes. I think anybody that plays a contact sport, and I would have a very broad definition of contact sport to include sort of the non-official, like soccer and basketball, those things. I think they should have this evaluation done annually. It doesn't take long. If you know what you're doing, it's a good history, a good exam. You use technologies, you use testing with whether it's a neurocognitive test or imaging or something even fancier in the right cases. But that conversation is a 20 to 30 minute conversation and examination, and you've learned so much from that. That can really, really help, just like I said, going back to the beginning, improve the neurological health of my patients, of athletes of all types. That's what we're trying to do. And that's what brain health baseline testing should be.
And there's no doubt the work that you've been doing and others have been doing, you can feel that if you're either playing a sport or if you have kids that are playing a sport, you see this took place, I don't know, within the last 5 to 10 years, the concussion forms that you got to fill out. So there's already an awareness when you're putting your child into a sport that this concussion thing is a big deal. It needs to be taken seriously. And I do think you need to err on the side of caution. Like you said before, that's a smart thing to do. But also you hate to see kids maybe that don't participate in sports because there's too much fear about it as well. You don't want to have them miss out on those experiences. So just as quickly as you can, what advice would you have for parents out there that are nervous about having their children participate in sports because of concussions?
Well, the first thing I'll say, you know, we see in our program probably, I don't know, 3,000 to 4,000 patients a year. And so we have a lot of patients that come to us and their parents bring them wondering if they should play, should they stop playing, that kind of question. Or they've already stopped and they're still having problems, so they think they're damaged, and what can we do to help them? I can tell you unequivocally, the number one thing we see in that scenario are our patients having problems because they're not playing sports anymore. So in other words, they're told to retire, or they're not allowed to play anymore because they've had 2 or 3 concussions, which is, again, doesn't make any physiological sense that should be a concern. But that being said, they're told they can't play. Well, that starts, like, incredibly predictably, that will create problems, whether it's just a pure physical lack of exercise, but it's usually you're stripping them of so much more of social developmental, even, sort of academic pursuits that go along with sports. Like all of a sudden you've got patients who can't sleep at night as well. They're anxious, they're more depressed, their headaches get worse. They're in a bad spot. And it's assumed it's because of that last concussion or whatever, when in reality, once we do an evaluation, determine it's safe for them to play their sport, they go back and their symptoms go away. Incredibly common that that's the case. The number of concussions is not the end of the conversation, it's the beginning of the conversation. And every time we make that sort of discussion and we make those decisions about, no, maybe you shouldn't. Again, going back to the beginning, we take very seriously, well, what is the positive side of that equation? And we look at that every single time.
Yeah, I think any parent out there would benefit by having a conversation with you and having their children involved so their opportunities are not missed out on. And on the other hand, it shouldn't be ignored and say, well, I'm not worried about it at all. I think it just should be addressed, get as much education as you can, and then make the best decision from there. So, and you've done so much and your work never ends, but just kind of let people know what you're doing right now with your clinic and things you're looking forward to in the future here.
Sure, yeah. So, man, we're doing so much. And one of the things that I love about my job is every day is diverse. We'll see, really young kids who are just starting to play sports. We'll see professional athletes, college athletes, everybody in between, former athletes. And so I don't want people to get the idea that you have to be in a sport to come see us. Really, any neurological concern that kind of comes from or is involved with somebody in athletics or around athletics or used to be an athlete, that's what we do. We have two major geographic locations here in Southeast Michigan and then out in Park City, Utah. I kind of bounce back and forth. I have full-time staff in both places. In Michigan, probably 2/3 of the time versus 1/3 out in Utah. We did that on purpose so that when people, well, a couple of reasons. One, we have a lot of folks flying in to see us. And so it's easier for the western half of the country in North America to access Park City than coming all the way out here to Detroit. But also the communities are different, the sports are different. We get a lot more action sports, a lot more, as you can imagine, snow sports out in Park City. We get a lot more hockey here, a lot more basketball and football here. So really, you can just go to kutcherclinic.com, see the phone numbers there, give us a call, and we'll be happy to see you at either location. Whether you're local or you want to fly in to see us. And then we've started a partnership really with Henry Ford Health System here in Detroit to provide their sports neurology as well. So it's sort of an additional clinic that we have here in Southeast Michigan. Again, you can get to us through the Kutcher Clinic, or you can call Henry Ford and ask to come and be seen at the Kutcher Clinic at Henry Ford. That's another option for us. Actually, right now I'm in our new clinic at the Detroit Pistons Performance Center downtown Detroit, which is beautiful location, easy to get to. Parking's easy. All the stuff people are like, I don't want to go to the doctor. But also I should say telehealth. I mean, telehealth is awesome. We've been doing telehealth for years. It really grew out of my role with the ski team because at any given time, I've got athletes all over the world who are competing and training, and I have working with clinicians on the ground, either a physical therapist or a primary care sports medicine doctor or orthopedic surgeon who need neurological backup. So we've been doing this for years, and we're been doing it. We're good at it. It's normal to us. So that's another avenue. People, if they don't really want to maybe fly to see us, we can set up a telehealth visit too.
That's an interesting one that I hadn't thought about, because all the doctors I talk to have gone to telehealth and they're going to keep using it going forward. But let's just say someone was competing in a game, to throw that example out there, and they didn't have time to come see you. Are you able to, through a telehealth meeting, diagnose concussion? Can you do proper testing through that, or do you really need to be in person?
I would say it's always better to be in person, no question. You can just get much more rich information, even the history itself, the communication, how people speak, all that is much more clear in person. And there are obviously some things we can do physically in person that we can't do via telehealth. But I would say telehealth is a pretty good option. You can get a lot, especially if there's somebody on the other end to kind of help with the exam part. We can do a lot on camera, but if I have an athletic trainer or I have somebody who can, help with the exam on the other end, it's even better. We did this actually with the Premier Lacrosse League. We ran their neurology. They did a bubble season, expanded tournament kind of season in Salt Lake City, and we provided all of the neurological care via telehealth, the baseline testing and the post-injury evaluations and management. So it's possible for sure to do telehealth for that, but always better in person.
Very good. Well, hey, thanks so much for joining me today. I think concussions are very serious, but they're also very manageable if you take care of it and talk with the right people. So reach out to Dr. Kutcher and his clinic, even if you don't have symptoms, just to kind of see where you're at going forward. So thanks again, and best of luck to you.
Oh, you're very welcome, Ryan. Thank you for the opportunity. Take care.